Transportation Learning Collaborative. As always, we have members of our BRI Care Consultation team here with us today, as well as two speakers. So Lisa Weitzman and Franklin Sheen are here today to do a little bit of a deeper dive into their partnership that they have together with their organizations working collaboratively to deliver the new CMS guide model. And so they're going to be talking about that today. And then after that, there'll be plenty of time for group discussion, question and answers, and so on after that. You can go ahead and go to the next slide, Molly, please. Next slide. And next slide. Okay, so before I pass it over to Lisa and Franklin, one of the things that we wanted to do is we have a lot of different organizations represented here today. And so we want to make sure we're tailoring today's discussion and get to know a little bit more about each of your organizations, where you're currently at, and then any challenges you're experiencing, and then what you hope to gain from these sessions. So we have a poll first here that Molly is going to put up on the screen, asking your level of familiarity with the new Centers for Medicare and Medicaid guide model, and whether or not you are a participating site in the guide model, if you're a partner organization. Maybe you're familiar with the guide model, but your organization itself is not participating, or maybe you're new to the guide model and you don't know as much information about it. So hopefully we can start getting some good responses on that polls again, so we can kind of tailor our content for today. So it looks like we have a good mix of people who are participating in guide or familiar with guide, and then individuals who are kind of new to the whole CMS guide model. So that'll be really great discussion and learning moment here as we talk about today's content. So thank you for that. And then go ahead and go to the next slide, Molly, please. And then the second poll that we're going to put up is not only maybe for today's discussion, but also for future learning collaboratives. We really want to make sure that the topics that we're discussing and the speakers that we have are able to address concerns, educational topics that you are experiencing at your organization, and it's content that you're interested in learning about. So the next poll is going to ask you about any challenges or barriers to implementing either dementia care and services or caregiver supports that you're currently facing that you would like to learn more about or get some more information on. We have a couple suggested options like recruiting and enrollment, marketing and to your target audience, funding mechanisms, staffing and organizational resources and or restrictions, maybe specifically questions or challenges related to the CMS guide model and the care delivery requirements that are a part of that, and any others you can feel free to enter in yourself. We'll give people a moment to work on that poll. Let's see. So it looks like, again, pretty good mix of responses. A lot of marketing to your target audience, funding, some very guide specific questions. I don't know, Molly, if you're able to see any of the written in responses, if anybody provided a written in to the other topics. If there are, we can probably talk about that during the Q&A portion if we can get those up. But that's good information to know. Thank you for providing those poll responses. It's going to help us, like I said, not only maybe help us with our discussion today and answering some of these questions today, but will definitely help us frame our sessions moving forward and making sure we're providing you with good topics that are helpful. Okay, you can go to the next slide, Molly. So I'm going to pass it off to Lisa and Franklin. I'll introduce Franklin Sheen. He is the Vice President of Clinical Operations at Tembo Health, a digital healthcare company on a mission to making managing dementia care simple. At Tembo Health, Franklin oversees the company's care delivery to seniors as well as manages its participation in the Medicare's guide model. With over 20 years of experience in healthcare, he has worked to improve outcomes, engagement, scale, and leadership in the space. And Temple Health, like I mentioned, is a guide model participating site. We also have Lisa Weitzman, who is the Director of Strategic Partnerships here at Benjamin Rose, where she works to align the organization with health systems, businesses, and community groups to support older adults and their caregivers. She also oversees We Care Because You Do, which is Benjamin Rose's own delivery of our evidence-based caregiver support program, BRI Care Consultation. And Benjamin Rose is a CMS-approved guide participating organization working with Tembo Health. So I will pass it over to Lisa and Franklin. And if at any point you guys have any questions that you would like answered to be talked about at the end of the session today, feel free to include those in the chat or the Q&A feature. So take it away. The other David Bass, it looks like.
Exactly. Well, the real David Bass, please stand up. So anyways, welcome everybody. Thank you so much for joining us today. We're excited to talk with you about our partnership related to Guide. So what is We Care? As Morgan said, We Care is Benjamin Rose's delivery of its own evidence-based program, BRI Care Consultation. We being Benjamin Rose, launched We Care in about 6 years ago under the auspices of our strategic plan, when we realized that we could really be not only licensing our program, but delivering it. And thus has been the journey of what does it mean to be delivering your own evidence-based program, and what does it mean to commercialize it? So it's been an amazing journey, and Guide has certainly been a huge step forward for us. But what is it that we actually do? I think the easiest way to think about our program is that we do two things. The first thing we do is that we help caregivers feel more confident in providing care, whether it's connecting them to the information they need to make good care-related decisions, whether it's helping them navigate community resources because they've never had to do it before. We Care is really about how do we help people feel more competent. We know that caregivers often show up at our doorstep. They've gone to a doctor's appointment innocently enough, left with a 5-page care plan, and they don't know what to do with it. They don't have the training, the skill sets, the time, or maybe even the desire to do it. But there they are, and they're responsible for that older adult who is going to be aging in the community. And if they want to stay in the community, it's up to that family or friend. So We Care, again, is about that competency. But that's only looking at that person within one lens, and within the lens of what are you doing for somebody else? But we know that people have lots of different sides and lots of different commitments and things that they're involved in, and all of them are impacted by caregiving. But all of them are also important in defining who that person is for him or herself. And so We Care also spends a lot of time thinking about how do we support that person as a person? How do we work with a person who has worked so hard to care for mom or dad that they've had to quit their own job, but now they don't have enough money to pay their rent, or maybe they can't afford to buy enough food? Who's paying attention to all of those things that person that's happening in that caregiver's life that ultimately will impact their ability to provide care? So We Care spends time building that care team, that supportive network around the caregiver, and then creating space for the caregiver to say, you know what? I promised to love this person until the end of time, but I never signed up for this. And I'm angry. And I feel really guilty that I'm angry. And I think I'm mourning somebody who's still alive. And now I feel worse about myself. And I can't go on like this. We Care then steps in to say, what can we put in place for you so that you can take care of yourself and enable you to continue to care for somebody else? So that's a very high level view of what We Care is. And Franklin, I'm going to pass it to you for an overview of Tembo Health.
Thank you, Lisa. And that was a great introduction, I think, about We Care and Ben Rose. And I think to take a little bit step further to build upon what Lisa mentioned is Tembo Health. We are also focused, I think, thinking about senior care and also about dementia care. We have everyone at our company has that personal story of being impacted by dementia. And we saw this care gap from a clinical perspective, where a majority of patients and a lot of families feel sort of left behind trying to get a diagnosis or even post-diagnosis, right? We know that statistically more than 50% of PCPs feel uncomfortable diagnosing a patient or managing a dementia patient. And so we wanted to step in here, provide that clinical expertise for these families to say, we know what it's like. We know what to help you sort of sift through the noise, similar to what Lisa shared from a We Care perspective, and continue your clinical journey around dementia care. And so we provide diagnosis and assessments, making sure that you don't have to wait 6 months to get an appointment to figure out whether you have dementia or not, as well as creating personalized treatment plans. I know Lisa mentioned a lot about how do you create a plan around a person. We also do the same thing, but we also think about it from a family perspective. And Lisa can speak to this as well. But often with people who are living with dementia, it's not an individual journey, right? It often involves a caregiver, multiple caregivers. So how do you create a care plan that's not only focused on the individual, but thinking about the caregiver, thinking about the family and the experience? And so we tailor those needs, those goals, and those challenges that often families living with dementia are dealing with. I think the other aspect that is sometimes a gap for families living with dementia is, how do you address the multiple different needs impacting these families, right? And so dementia is often not the only diagnosis that these individuals have. They have symptoms that they're also dealing with. And even those symptoms that are related to dementia, one person might not be able to address all of them, right? And so we have specialized family medicine, geriatric psychiatry, as well as emergency physicians taking a look as part of our care team to making sure that we can cover as many bases as we can regarding an individual's care. And I think a really key piece in terms of dementia is also thinking about medication management. And so we do on a regular basis as part of GUIDE, and also outside of GUIDE, reviewing patient medications to help address those unnecessary medications, the high risk medications that are out there, and really thinking about when it makes sense to have dose changes for those patients. And so there's a lot of things that we potentially do, and we're seeing a huge impact, I think, through the GUIDE program and outside of the GUIDE program, of making sure that we can help families age in place as best as possible and as safely as possible. And so that's a good segue into the GUIDE program. I know from the poll at the beginning, the majority of you are familiar with it. And so I'm not going to spend too much time talking about it. But if you're familiar with, let's say, the Cancer Moonshot, maybe a couple of years ago, you can think of GUIDE as the Dementia Moonshot coming from Medicare. It's an 8-year program that is designed to help people with dementia age in place by providing additional support and services focused around a standard set of care for these families. I think the benefits there are they are assigned a care navigator. They should have a care team associated with them. 24/7 access is also a requirement of anyone that's participating in GUIDE, and really helping through something like a We Care, provide access to community services and support for those families with dementia. And I think a really also attractive benefit that a lot of families resonate with is also that $2,500 in annual respite grant money that they can use for in-home help or adult day or overnight facilities. And so something that launched in July of last year. A lot of providers had to apply to get into it and got approved. And so I know some of you are on this call. I think there's about 100 that were approved for the first year, and another 300 coming in July of this year to round out I think about a 400-person team of providers and organizations providing GUIDE care. For people who are not familiar with GUIDE, happy to talk about the eligibility, which is on the next slide. And so not everyone can participate in GUIDE from a patient perspective. We sort of sum this up into 5 criteria that you're looking for patients that can benefit from the things we mentioned before. So the first is they have to have a dementia diagnosis to be a part of GUIDE. If they don't have one, for us, we do that diagnosis. And so we can definitely diagnose them as part of the GUIDE enrollment process. But this is only for families that have that dementia diagnosis. Second, they should be on original Medicare. And I know one of the questions or challenge that people had was around enrollment and recruitment. This is probably the largest sticking point. A lot of people don't understand if they're on original Medicare or not. And so I think this is where we have the largest challenge of trying to get alignment and understand the eligibility of a patient is whether they are actually on original Medicare or not. But they have to have that as their primary insurance. It's okay if they have supplemental insurance. It's okay if they're on Medicaid, but they can't be on a Medicare Advantage plan or a special needs plan. Thirdly, they can't live in a nursing home. Fourth, not enrolled in hospice. And fifth, they're not enrolled in PACE. So the criteria aren't extensive. You also notice that there is not an income requirement to be part of GUIDE. And so I think that's another attractive piece of this for families. But we try to keep it simple. And this is what we typically do during the recruitment process is go through these 5 things initially of whether a patient is eligible for GUIDE or not. The next slide talks about, well, what happens as part of GUIDE? And so I mentioned a little bit earlier, as part of GUIDE, any single GUIDE participant is required to execute on 9 care delivery domains. And so this is the standard set of services that every single participant should be able to give their families that are enrolled. I'm not going to read all of them, but you'll see comprehensive assessment, which is around diagnosing or testing to the dementia diagnosis of the family. Caregiver education support is a huge component of this. If you look at 5 and 6, I would also talk about the coordination, not only from a clinical perspective with other specialists, with appointments and doctors, but also referral to community services like transportation, food, respite. Those are all important aspects that we're trying to deliver from a care delivery perspective. And so all these 9 things are part of the GUIDE program, and every single family can benefit from one or all 9 of these different domains. Given that 9 domains is a lot, and as much as we would love to be perfect, we're not. We have a lot of different gaps out there in terms of our care sometimes. Benjamin Rose is a great organization, but we add on that clinical piece as well in terms of the care that they provide. And so there is a huge benefit, I think, in terms of partnering for better outcomes as it relates to the GUIDE program, whether it's about respite or anything else. And so for us, I think Benjamin Rose came out to be a great partner from a community expertise perspective. They've shared on a number of different their webinars the expertise that they bring, the services, the resources, the connections to the community that they have. And so it's a great place for us to start in terms of our GUIDE program, partnering with Benjamin Rose in the Ohio area of, well, what can we do here for this geography and get that support from that organization. Then on our side, we provide that clinical expertise that you heard a little bit earlier around that diagnosis, medication. If there's any urgent health issues that their PCP can't answer, we're happy to jump in and fill in that gap. And that way we can sort of bridge both the community, the social side, and the clinical side to provide that whole dementia support. The big question that we often get, though, is how does that work? And so if you go to the next slide, we typically sort of take on the beginning piece, or we work together from an identification perspective. And so we have patients that come to us from Ohio that reach out looking for services. Ben Rose has a number of patients that reach out to them also that might be eligible for GUIDE. And so we come together, we try to evaluate the eligibility of those patients. If necessary, that might be a call. It might require a huddle with Benjamin Rose to go through some of the details of the patient to really understand their eligibility. But then we're sort of off to the races. We'll assess that patient either in home or virtually. Then as part of the GUIDE program, they have to fill out a couple of surveys or questionnaires to apply. And so we collect that asynchronously or synchronously when it makes sense. And then lastly, as they get reviewed by CMS, once they get accepted, not to sort of overwhelm updates to Benjamin Rose, is then we share that data of that patient to Benjamin Rose so that they are starting from a rich amount of information that we've collected so far from the GUIDE enrollment process. And so they get the comprehensive assessment, the caregiver burden results, Promise 10 prepare surveys, our care initial care plan, anything we've done from a mental health screening perspective, but all that information is shared. That way, when they do engage with the patient, they have a really strong starting point to think about, well, what else can we need and add to the care plan to create even more robust purpose for the meetings that we have and the check-ins that we have with these families. So that is sort of that official handoff that we have with Benjamin Rose. And we rely on Benjamin Rose to do those regular check-ins once a month or as needed with those families to sort of help them deliver on those care delivery domains. And then we are sort of there as needed for clinical huddles, medication reviews, and also urgent care if there is a health issue that is an emergency that needs to be addressed for the family. And so we've seen this sort of work well. We've had families talk about their excitement about the program and what we do here. And I think from Benjamin Rose's perspective, we really leverage and appreciate their deep understanding of dementia, right? I think the other aspect I mentioned before of why we reached out to Benjamin Rose is I think their deep connection with the community. They are embedded as part of the community. They have great partnerships. I think someone mentioned about respite care as well. Benjamin Rose has a history of working in this geography. They've already established those respite partnerships and knowledge. And so they were able to provide those as great partners for us to potentially work with as we provide a respite care for these families. And so it's this comprehensive personalized care coordination that they provide that really resonates with us, that really supplements us from a community perspective and provides that value that we're looking for that comprehensive dementia care.
Thank you so much, Franklin. And so I think from our side, why Tembo Health? Having heard all of what Franklin said, it's probably pretty clear that we realized how lucky we would be to partner with Tembo, that we are really fundamentally at our core mission, totally aligned, focused not only on the patient, but recognizing that a dementia diagnosis impacts everybody living with that diagnosis, not just the person who has been diagnosed with the disease. And so that deep understanding of how does dementia impact a family? And then what is our responsibility and our ability to provide support around that entire family unit? The other thing we really value in Tembo, obviously, is their expertise, filling the gaps that we don't have. We don't have the ability to do medication management. We don't have the 24/7 access, which for families who are caring for someone who at 3 o'clock in the morning, behaviors change, you don't know what to do. Having that number you can call to support you is extraordinary. And what a value add for the people that we provide services for. Tembo also, when we were looking for a partner, we wanted to find somebody that was committed to collaboration and that really wanted to work with us, that was person-centered, which is important to the work that we do. So all in all, Tembo had all of those things that we were looking for. And so we are just excited and honored to be leading this partnership with us. Next slide, please. So you may be wondering, how do you find partners and what partnerships are out there? So we like to think about it really as sort of a Venn diagram. So in the center is your guide model. In one circle that overlaps in your Venn diagram circle is that whole question of what does the community partnership, what is the care navigation piece of your team going to look like? And there's several ways that you can answer this question. You may decide as an organization, you know what, we would like to actually purchase a license and deliver a program ourselves. As you may know, CMS has chosen 6 programs that they have decided are truly appropriate for guide implementation. BRI Care Consultation from Benjamin Rose is one of those 6 programs. And so you may say, you know what, we have the staffing, we have the capacity, we can do that on site. But some people say, you know what, we know we need that care navigation. We need to be able to address all of those 9 care delivery domains, but we don't have that care navigation piece and we don't have the bandwidth to deliver it. And in that case, organizations can decide to contract with an organization. Perhaps you choose our program, We Care, and allow us to deliver it in collaboration with you, much like Tembo Health has chosen to do for itself. So that's one of the partnerships that Guide has us look at. The second circle that Guide has us look at is the circle around what I would call the healthcare side of it, the clinical support. The clinical support is important not only because you're looking for mostly, I guess I would say, the reason it's important is because you're looking for referrals into the program. We know that primary care providers, as we've talked about at the beginning, are oftentimes struggle with, well, I've diagnosed Ms. Smith with dementia, but I don't know what to do next. So being able to partner with primary care providers, other healthcare specialists who are in contact with older adults who are living with dementia, and being able to say, look what we can do in addition to all of the work that you're providing. So in no way does this partnership mean that we are replacing somebody's existing medical team, but rather this is in addition to, on top of the services they may already be receiving at the local level. And the last level of partnership that's so important is the respite providers. I know this is a huge topic for everybody. The reimbursement structure for respite also makes it challenging, but really thinking about, what does respite look like along a continuum? And how are you going to find organizations that you can plug your families into that can help to address that? Whether you're talking about collaborating and contracting with a home health agency, whether it's an adult day program, or both. Next slide, please. So how do you become a guide partner? So there's several ways of there's several steps that need to be taken. So let's say you found the perfect partner and you say, great, we're going to do it. What do you do next? So the first thing you do is you sign a partnership agreement. And this partnership agreement, and the guidelines for this are very much established by CMS. There's no need to be creative or reinvent the wheel, but they lay out in very clear detail who is doing what and what is the rate and the payment terms that are going to be agreed upon for those services. So you may know that CMS has put out a rate schedule that, depending on what stage of the disease somebody's living with, and also whether or not they have a caregiver on site, and that rate, and CMS during that whole assessment phase assigns somebody to that bucket. So you, as the providers, don't have to decide, does somebody have early, moderate, or later stage disease? But when the assessment data gets sent to CMS, they come back and say, Ms. Smith is moderate, living with a caregiver. Once that, we then took that rate schedule and we came up with, what is the piece of that rate schedule that Tembo Health will pay to Benjamin Rose for the services that we're providing. So we now have an established rate system. And so each month when we bill Tembo, so that Tembo can then bill CMS, we let them know we served Ms. Smith, and this is the category that she fits in, and this is our agreed upon rate for the services for that month. So all of that information, though, even before we can start billing, all this information is gathered about us as the partner organization. And this came, I think, as a little bit of a surprise to Benjamin Rose with the amount of information that CMS required of us. It even required the social security numbers of our leadership team. We're not 100% sure why, but that was, again, an important piece of this whole contracting with CMS. So again, it was a good test of the partnership from the very beginning. How are we going to share all of these social security numbers with you? And so we figured if we could jump over that hurdle, we were good to go with anything. But then becomes the wait. And you really can't begin, you can begin to deliver services, but you can't begin to bill for services until CMS approves you as a partner. And we found it took about 3 or 4 months, as it says on this slide, for CMS to say, yes, Benjamin Rose, you can be an approved partner for Tembo in delivering guide. Next slide, please. So there was, somehow we don't have quite the right slides up here, but there is the thought about thinking about what can you, I guess, the ways to deliver the program. So 2 ways, if you are interested in BRI care consultation. One is you could become a licensed site. And what does that mean? So it means that you contract directly with Benjamin Rose, and we work with you to become a delivery site of our program. We provide you with access to our software, we train your staff, we provide ongoing monitoring and support, and we host your data. We also help you with marketing the program, helping you to figure out how to recruit people into your program, and really sharing all the things that we've learned on our delivery side with you to help you be successful in this. Again, this is for people who say, yes, I want to bring this all in-house and I have the capacity to do so. We realize though that also, and if you do decide to become a licensed site, one of the key success things is having a supervisor on site who recognizes and works with the staff, understands what they are doing, and supports their delivery of the program. Next slide, please. The other way you might think about accessing a program like ours is to actually contract with us. So you get exactly the same service for your client. We deliver exactly the same program, but we do it from Benjamin Rose. So you have the benefit of getting the program directly from the people who designed the program, who are working hand in hand with the research team that designed it and continue to update it and what have you. You don't have to worry about training staff. You don't have to worry about supervising staff. That's all handled for you from the Benjamin Rose side. And then we come up with a contracted rate that we would agree upon to deliver the service on your behalf. And that again is the model that we have chosen with Tempo Health. Next slide, please. So I think, oops.
I was going to say, Lisa, are you the slide that you're missing? Is it the how can we get involved slide?
Yes.
Okay, Molly, I'm going to request to share my screen really quick because I have that slide pulled up here. And we'll share that. Yeah, we'll share that for you, Lisa.
Thank you. So
right.
The last question, how can I get involved? So I think there's lots of things that you can do now if this is an intriguing conversation. First of all, it's realizing, you know what, this guide model really offers a lot for the patients and families and caregivers that I serve or that I work with. Recognizing that this is the first time the federal government has said, yes, we need to acknowledge all that goes into being a caregiver and we need to support them. So the first and easiest way is to refer your patients or clients to a guide participating site for these supplemental specialty services. There is a list on the CMS website that will list out all of the local providing sites in your area or some of the organizations that have the capacity to deliver it regionally or nationally. You might also say, well, I want to be more involved in that. I would actually like to be a partner organization for a local provider. Again, looking at the CMS website for guide, determining who is delivering guide in your area and reaching out to them. And it's interesting because you would think, well, before they applied, they would have had this all figured out. And what we have found out is that actually isn't true, that these guide organizations, these participating sites are always looking for new partners, always looking to enhance the model and the services that they're delivering. So it's never too late to have that conversation. The other thing you can do is help to build awareness that there are Medicare covered services that provide quality dementia care. So often when we talk with people, they say, well, I've never heard of Guide, or I have no idea what you're talking about. And so one of the, given that this program is offered at no cost to the people who qualify for it, I think collectively, we are all responsible for spreading the word, for letting people know you don't have to navigate this alone. There are supports that can help you both to navigate the community side and the healthcare side. You don't have to reinvent this wheel. And so how do we collectively get this word out to all of the communities of which we're part? Not only our professional communities, but our personal networks as well. And then also, and lastly, it's thinking about how you might implement these wraparound services outside of Guide. So while we might say, well, Guide right now focuses only on people with traditional Medicare, there are clearly lots of people out there who are on a Medicare Advantage plan, who are on an MCO plan that could benefit from the seamless coordination of care, and recognizing that the services that Benjamin Rose provides, the services that Tempo provides, aren't just specific to traditional Medicare. It is under the guide model, but we have the ability to serve people with so many different insurance plans. So it's thinking about how might we all work together to continue to spread the intention of Guide and the services of Guide to the greater community. And with that, Morgan, I will pass it back to you.
Great, thank you. So Yep, I think there we go now. Thank you both, Lisa and Franklin. That was very, very helpful. And I think we have a couple of questions ready for you in the chat that attendees are interested in. The first one being, are you aware of any area agencies on aging that are acting as guide partners for care navigation or other services?
So I can start with that, and then the Benjamin Rose team can certainly fill in. So that actually has been a big push of ours, is how do we better engage with the AAAs? So for us at Benjamin Rose, we refer to the AAA for services, particularly for their family caregiver respite dollars, if people need additional respite dollars outside of what Guide is offering for them. But also we're helping them to recognize that they would be a great referral partner, and that this is a great way for them to bring enhanced services to the people that reach out to them, knowing that as we work with families and individuals, we will refer them back to their own AAA for the services that they provide in the community. So that is right now a very big intentional push of ours.
I think to build upon that, and just to clarify a little bit of a nuance, is a lot of what we shared about is an official guide partner. But you can definitely have partners out there that are not an official guide partner. I think triple A's can be one of those. So it really depends on what type of partnership you're looking for. But whether it's a transportation company, a triple A company, you can definitely partner with them in terms of, getting information, sending patients their way that might be helpful to leverage their resources. But I would say if you're looking for them to do care navigation, that's where you have to set up an official partner organization agreement with them. And I personally don't know of any that are doing that care navigation for a guide partner, but I believe I've heard of at least one participant. If you're interested as a guide partner, as a guide provider, let me know. We have a group chat that we meet on a regular basis actually to get best practices, talk about partnerships that the people are working on and so forth. So happy to add you that chat, and you can also ask that question there. And so I do believe there's at least one I know of in some state that's trying to work with the AAA at the moment.
Great, thank you. And another question that is kind of related to what you were just alluding to there was, what are some examples of the contracted rate and maybe some of the nuances about contracting for guide services?
Yeah, I think the easiest one is definitely respite. And so those rates have been set by Medicare. And I think, for example, from a respite perspective, it's $120 for a 4-hour unit of service. There is a little bit of give or take there from a geographic adjustment factor that Medicare also takes into account. So if you're in a high cost of living area, that might be higher than 120, like 135 or $140 for 4 hours. Or if you're in the different geography, it might be less than $120 for 4-hour units. But those are set by Medicare. We are not allowed to charge any difference of that rate back to the family. For things that are not respite, for other care delivery domains, I think it really depends, and it really varies depending on the partnership you're talking about. I think what Lisa mentioned before is you have to sort of what we call a crosswalk, and we spend a lot of time with Benjamin Rose doing this, of, well, for this care delivery domain, what are you going to do? Who's responsible for this? If it's 50-50, who does what and who does what? And so because it's a little bit custom to, I think, every single partnership, I think the rates are difficult to sort of share, but they are public from what is given from a monthly perspective, and you can always use that as a starting point when you're negotiating your contracts with each other.
Great, thank you. And we have another question that I'm assuming is going to be for you, Franklin, as well, is about how the data is entered. I'm assuming for the billing services.
The billing services. So for the billing services, one of the requirements of a guide provider is that you have to have an ONC certified EHR. And so I think there's a little bit of confusion of what platform that you should give. And I think there's a lot of care navigation. And there are, I think, even some new guide specific platforms that are out there. You still need to have an ONC certified electronic health record system. Some of these EHRs also usually do claims submission, what is usually called like revenue cycle management or practice management. And so we submit all our claims through our EHR. We personally use Athena Health, but there are guide partners that are using Epic for their EHR. I think some Practice Fusion, Terrio Health might be another one. Healthy is another popular EHR. And so usually the data is entered in that way. From a Ben Rose perspective, though, we need to get that information from Ben Rose. And so the way that we've arranged it with Ben Rose is they enter the notes and the care that they provided via an online form. That gets sent to our team and automatically into our database. And then we review and submit that through our EHR to CMS for review.
Great, thank you. And it looks like we have a couple people responding to you, Franklin, saying that they would be interested in being connected with that group that you mentioned. So we'll definitely take down people's email addresses and make sure those get passed along for additional information following up on that.
For those that include your cell phone, it's a WhatsApp group, and so you have to have the WhatsApp app in order to join. And I think that's linked to your phone number. That's how we would add you as a member. And so once you share that, happy to sort of go through your information and add you to that group.
Great, thank you. That's all that we have coming in through questions as far as the chat right now. If anybody has any kind of last minute questions that they would like to ask either in the chat, or you can feel free to come off mute and ask any questions. It doesn't have to be guide related. It could be non-guide related about maybe any of those challenges or barriers that were just mentioned in the poll at the beginning of the session as well. Yeah, Sharon, you have a question?
Yeah, thanks. I didn't want to jump in because it's a little bit off the topic in terms of the official partnerships that you're talking about for GUIDE, but I'm with the Association for Frontotemporal Degeneration, and we are very interested in trying to find the right ways to intersect with the GUIDE model as a resource, both for education for professionals who are serving folks who may have FTD, as well as for families. And I wonder if if any of you have just some suggestions. We're really looking at really where are the best places to intersect, probably not through the formal partnerships that you're talking about, because we wouldn't be providing direct care, but we do think that this is such a fabulous model and a fabulous opportunity to continue to increase the quality of care for people with any type of a dementia. So we're trying to learn and see what we can do and offer.
So I'll jump in first, and then Franklin, please come behind. So I would say that, you know, we can offer several things. One is being able to talk with providers and let them know about the program, right? That the whole educational piece. What is GUIDE? How does it work? Who's appropriate? What have you? And then the second, I think, from your side is when families reach out and are struggling, and you think, you know, you would really benefit from perhaps a GUIDE model. I'll just speak on behalf of our program with Tembo, knowing that if you come into Benjamin Rose, if somebody is, so these programs are both delivered virtually. So we have the ability to deliver the program regardless of where someone physically lives. And so being able to come in and say, you know what, you may or may not be eligible for GUIDE, but you're eligible for all of the supportive services that WeCare provides. You're eligible for all that extra level of specialized care through Tembo. Yes, it would be great if it was through GUIDE because CMS would cover it. You'd get that $2,500 a year for annual respite. But even if you don't get that, there's all the other supportive work that the programs provide, regardless of whether or not someone's with technically under GUIDE. And so being able to refer them, to connect them, to get them that support is something I think that's also really important that we can provide for anybody.
Sure, absolutely. Thanks. We definitely have that in mind and are excited to be able to do that.
Awesome. And Franklin, go ahead.
No, I think that's a great question. And so one requirement of a guide provider is that we're supposed to maintain a database of resources that we can recommend to families and individuals with dementia. I can see your organization being a great addition to that database. And so I think reaching out to any guide providers is a place to start. I think someone shared a list of the innovation models of all the guide participants that are in there. I believe there's also an Excel sheet that you can download from CMS's website of every single guide participant. Apologies for any guide partner that is on that. You're going to potentially get a flood of emails. I know I do already, but I think it doesn't hurt to reach out. I think we're always looking for partners that can really enhance the care for our families. And I think that's one way to potentially do that. I think another requirement for every single guide participant is one care navigators have to go through 20 hours of training, and also I believe 2 hours of CME annually every single year, right? And I can see your organization offering potentially really great topics that could supplement that education and training that could be great for, I think, organizations that are participating.
That's actually, just quickly to follow up, that we would be very interested in, but the efficient organization of that is really part of the question, right? So we can't really do 390 of those trainings. So continuing to understand what's the most efficient from the standpoint of like your side of the fence would be really helpful. We can take it offline, but that's part of the question for sure, because we'd be happy to do that. Thank you.
Thank you.
Sharon. Yeah, thanks, Sharon. Samantha, you have a question?
I do have a question. Thank you so much for taking my question. And I agree with others. It sounds as if the guide program is very good and will benefit a lot of caregivers. I have been one with my mother who was diagnosed with Alzheimer's. My concern, however, is some of the limitations that I believe guide is going to effect on lower income and minority communities, because we know that these individuals are more likely to have a Medicare Advantage plan, and the Medicare Advantage plans that are being offered in these communities tend to be those plans with fewer stars. So the care that they may be required to receive through those plans may not in the beginning be adequate. I guess my question is, how do we begin to address a population and a community that historically has been left behind when innovations such as guide become available, yet they are beyond the reach of those that may really need the care and the service?
Yep. So I'll start and then Franklin, I'll pass it again to you. So that's something, Samantha, that we have really been struggling with here, in the sense that if you look at who really needs access to better services, who really needs the support that guide provides, who needs the dollars for respite, it's most likely not the people. It's less likely to be people on traditional Medicare, and more likely to be people on a Medicare Advantage plan or on Medicaid. So why are we starting at the end, why are we starting with the people who maybe need the services the most? So, or don't need them as much, I should say. I apologize. So I think, to be said, we are continuing to, there's a lot of conversation with CMS around how do we expand this program? How do we reach the communities that really are in need? And how do we grow this program? And so on the one hand, it's saying, we are grateful that the federal government is finally recognizing that there is the need to support family caregivers of people living with dementia. And on the other hand, but there's a huge part of our population that needs this support more than anyone that we're not even able to serve. So one, it's the advocacy piece, continuing to push this forward. Two, it's the recognition of it's a great model. So in the interim, while we're waiting for CMS to pay for it and for it to be part of the official model, how do we in essence do it on the side, in the sense of recreating, delivering these wraparound services for families, giving them access, even if it's not officially under guide, but giving them the guide level and quality of care that they deserve. Frank, I'll pass it on to you.
No, I think you captured it really well, right? I think you highlighted the observation that a lot of people notice, that the people who would benefit from a program like Guide might not have access to it. And so there's this huge advocacy piece. And I think from a lot of these payers that offer these Medicare Advantage plans, they might be having a wait and see type of approach of, well, if Guide is successful, maybe it does make sense for us to incorporate something similar into our Medicare Advantage plans. But I would definitely urge any Guide partner to also try to do things outside of Guide, as Lisa sort of mentioned, to replicate the Guide model outside of the traditional original Medicare. So for example, we're working with health systems. We're also working with health plans to do something like Guide, and doing those in certain geographies as well from a value-based care perspective. And so a huge advocacy on that part, but we cannot only look at CMS. We have to be proactive, I think, also proactively reaching out to those payers and health plans to see if they can sort of move fast or willing to experiment and pilot this type of model with their particular members.
And I think one other key community for that, particularly when we look at the virtual services that an organization like Tembo provides, is how do we reach rural communities where there are no medical services, particularly with a dementia specialty, anywhere nearby. But many of the people living in rural communities aren't on traditional Medicare either. And yet they would benefit so greatly from this access to virtual care. So
Right.
again, that conversation broadens to that community as well.
And I think that's a great point of not just advocacy for the dementia model, but I think advocacy for telehealth, even from original Medicare perspective, making sure that, technology, can you get reimbursed for just telephonic interactions, which Guide allows you to do, but outside of Guide, how can someone who does not have a computer, has struggling internet connection, how do you engage with those individuals and get reimbursed for that? You have to advocate also, I think, for that telehealth flexibility that CMS had during the pandemic, and can we continue to have that post the PHE?
Great. Thank you, Samantha, for raising that question, and Lisa and Franklin for your comments on it. It looks like we have a question from Melissa.
Hi, we're a guide provider in Napa, and I just have a question around marketing and outreach to the community. So, what kind of marketing material are you using? Are you guys printing out flyers? How are you guys doing that? And kind of what does that look like?
Michelle, do you want to jump on that?
I'm trying to, okay, I'm on camera. Okay. I can start it off. And it's rough. It's the same as marketing any type of program that you're looking to market. We have first gone with our existing customers, our existing clients, the people that we work with now. We're also a services organization. We offer a lot of services. So we're looking first to them, obviously, to see who might be interested and who might qualify. We do a lot of email blasts, obviously, because that's low cost. We're finding one of our partner organizations for another project does a weekly newsletter, and they're getting a lot of good response from people in their community from the newsletter because they're already a trusted resource in the community. We are looking at things like we're currently making incorporating Guide as part of our Google AdWords program. So there's not a lot of keywords being circulated these days for Guide and Guide related programs. So it's still really early there. So there's not a lot of searches being done in Google for those kinds of keywords and that kind of information, but it's nice to be the only one there. So we're doing that on a regional basis to try to capture the people around us or in the Ohio area that might be looking for services. Franklin, you want to add on to anything?
No, I think you covered a lot, and I think one thing to take away from there is a multi-channel approach is obviously going to be the most effective. The magic number out there is usually 7 touch points, right? Like if you engage with someone 7 times, they're going to remember your name and they're more likely to do a call to action. So think about how do you create those 7 touch points, whether that's an email campaign, a text campaign, a printed flyer, or a postcard. That's I think where we've seen that the more touch points you have, the more effective it is. But I think the other thing to also think about is this population gets sold at all the time, right? And so I think providing some sort of value to them is helpful. So whether it's a webinar around a need that they often face, or whether it's an event to talk about some sort of education piece, or during your support group, I think they really resonate with those things, right? And I think that's one aspect where I think you can sort of do well. I think on the flip side, where I think we've struggled from an marketing outreach perspective, which I think at first we thought would be pretty easy, is I think with physician offices that struggle with dementia care. And I think the reason why that's a little bit of a struggle is seniors might be a small percentage of their population, and of that percentage of their patient panel, how many of them actually have dementia, how many of them then are willing to have Medicare. And so it's just not at the forefront of their mind. And so I think it's not always necessarily the best unless you know of a physician practice that does particularly focus on dementia or cares a lot about the dementia population. Then they might be a great partner from a network. I would say regionally, another great resource is, you wouldn't think about it, but elder law attorneys, I think, are another great resource from a marketing perspective. They deal with families living with dementia all the time, and they want to give these resources to the families. And so they're always usually, I think, open to learning about these type of services and programs.
Yeah, that's great, Franklin. I just want to mention one thing that I forgot that is probably the most important is establishing referral relationships with other organizations in your area, whether it's a AAA or other older adult focused organizations. Just trying to establish, they're seeing people that are in need of the program, to establish the referral relationship with them is critical.
Great. Thank you, Melissa. And we had one final question entered in the chat that I think I'm hoping Franklin can answer just pretty quickly, about the educational background or requirements for the Care Navigator and what those 20 hours of training include.
So I would say officially from the CMS, there's no specific education requirement or background of the navigator. The 20-hour of credit of training is the same regardless of experience. So they could be a 20-year seasoned memory care a nurse, or they could be someone straight out of college. It's the same 20 hours that is done. That's split to between two different types. So 10 hours of didactic training, so like an online course or a teacher instructor led course, and then 10 hours of experiential learning, or let's say hands-on learning is what you're looking for. So officially, I don't think there's anything there. For us, if you're curious about, I think it depends on what we're trying to do. As you can imagine, with a patient panel, it can be pretty mixed. And so, for example, someone who does not have experience working with seniors or working with dementia, we would not provide them any complex cases, for example, right? We actually prefer someone with a clinical degree, like an RN at least, or with extensive years of experience to provide that care navigation. For someone who might be low and mild, that clinical degree might not be as important, but typically what we think works well is someone with a social worker experience that seems to deal really well with, I think, this population.
Great. Thank you. And that brings us right up to 4:30. So thank you, Lisa and Franklin, for joining us today. And if you want to follow up with Lisa and or Franklin, I won't volunteer Franklin's email. If you want to put it in the chat, go for it. But we will be putting Lisa's email in the chat if you have any specific follow-up questions that you would like to ask. And we're also including Michelle Palmer's email in the chat as well. Thank you, Franklin. If you have any specific follow-up questions related to BRI Care consultation, if you want to have a one-on-one conversation about it or a demo, please feel free to email Michelle Palmer. And then we are also putting in the discussion or in the chat a link to our next learning collaborative, which will be on Wednesday, March 12th from 3:30 to 4:30. And myself and my colleague Rachel Cannon will be providing a demo and discussion of best programs for caregiving, which is a free online database of 45 evidence-based caregiver support programs that are currently available for health systems and community-based organizations to adopt and implement at their organization, whether that be a guide model implementation site or a non-guide site. So we hope to see you at the next March Learning Collaborative. And again, thank you to our speakers and thank you all for joining. Have a nice
Thank
evening.
you.
Bye.